you so much for taking a few minutes out of your day today to talk to me, Anne. But tell everybody a little bit about why you're here.
I had to have hip surgery, and I worked in many hospitals, and so I knew to do my research. So I would talk to my physical therapist and ask her for some names, and uh, and then I researched those names. But and one of them, the second one was Dr. Goff, and I went to his website, and uh, I was very impressed, and I read about him, and I went back and talked to my physical therapist and asked her about the patients that she had worked with that had been through his surgeries, and everything was really positive and great. So we made our first appointment and came here. I was very impressed with the entire staff, especially the way they put together. And I don't know, maybe it was 2 hours we sat and went through the whole process and the procedure. They showed me my x-rays. They told me exactly what would happen beginning to end, and spoke with almost everyone in the office who came in and gave a little speech about their what they do in this office. That was very impressive. I've never seen that with a doctor before. And to just get it all at once and for them to take the time to do that and ask me all the appropriate questions, uh, that was impressive.
And tell us a little bit about your background. So you have a background in IT, right?
Yes, I've worked at Intel for 20 years. I started out in training, and when we went to the World Wide Web, of course, we're international and all over the world. And we decided to go online with all of our training rather than spending the money to take people all over the world. So I was a big part of putting together the online programs that we used for training, and I designed the original uh, software, what the screens would look like, and how we would gather. And I worked with all the technical guys, of course. I just do the pretty stuff; they did the technical stuff. And then I moved into IT, and then spent most of my career doing that type of work, working on software. I'm a certified usability analyst, and so I would analyze what they wanted and needed and then draw it up and then hand it over to the technicians to create it.
So tell us why you chose Dr. Goff in particular,
Oh,
right?
yeah, the
Yeah.
website, of course, the website. Yeah, I mean, because that's part of my job. Yeah, I went to the website and was very impressed with the website and read through it. It was easy to understand and read. And I was really impressed with all the charities that he donated to. And just those types of things are important to me. And I've worked in a couple hospitals. And so I kind of know what to look for. And this turned out to be the best experience. I can't even
So
imagine.
fast forward, how far out from surgery are you
My first one was a year ago, and I was having hip pain in my right, and went through that, and it was amazing. I mean, of course, surgery is tough, but got through it, had good PT, and felt great. And Dr. Goff had said, as soon as this hip feels good, the other one's going to hurt because I had congenital hip dislocation,
now?
and I knew that I was going to have my hips replaced, but I made it to 70, so I was happy about that. But then he told me the other one would start hurting, and I felt really great. And sure enough, my left started hurting, so I'm back for my second surgery, and it went much easier, right? And it was great. Everyone here has been amazing, and
Thank
and so little time. I like that I didn't have to be in a hospital.
you.
It was
No.
outpatient, and you walk away with a walker, and that sounds really scary, but it wasn't at all. In fact, my second surgery, I think I used the walker for 3 days. Didn't need it anymore because I kind of knew to do the exercises and everything. It was a great experience. So little, having not to spend time in a hospital overnight and to be home and to recover and start PT right away on the floor, and then the follow-ups was a great experience.
So, just one last thing, or is there any advice you would give someone else who's thinking about having surgery, might be a little scared, or any last minute advice you would give?
Um, it was not scary at all. It was it's amazing, the technology, and is at the top of it. You know, when I did talk to other people that had hip surgery and they were in the hospital, and even one woman, she was miserable. And she had it about a month before me, and she was not recovering like I did. That's really, to me, the recovery is really important, and having the people that you need there. Chris has been wonderful. Everybody in the office has been wonderful, but the whole way that they do it is you meet everybody in the office your first day. That's amazing. I've never had a doctor do that before. And you just feel welcome and you feel like you know everybody and you trust everybody. And then when I had to come back from the second one, it was like nothing. I was right home again, and I did recover very quickly with he's state of the art and he knows what he's doing and he goes around the country and teaches other doctors how to do hip and knee surgeries. And that knowledge is well worth the effort that you put in to check out your doctors.
Thank you. Thank you so much, Anne. We appreciate you so much.
No problem.